Let's discuss some tips and tricks for re-engaging adolescents and young adults in HIV care. Young adults have a higher risk for becoming lost to follow-up at every stage of the HIV care continuum. This data shows us that individuals aged 18 to 24 years are more likely to miss a medical appointment in the last 12 months. Individuals aged 18 to 24 years are less likely to take all of their doses of antiretroviral therapy in the last month as well. And individuals that are young adults are more likely to experience homelessness and more likely to experience stigma around their HIV status as well. There are a multitude of considerations when treating adolescents and young adults living with HIV. We must understand that their decision-making capacity is still developing. They may have higher rates of risk-taking behavior or a less understanding of the consequences of their behavior or their choices. They may have a desire to fit in with their peers and feel that pressure to do so. They may lack fully developed cognitive function. That frontal lobe is still developing. Social support can reduce stigma, though, and depression around HIV. And so individuals that have strong social support or family support structures may be more likely to do better. Also, physical development is still occurring, particularly for those individuals who have been perinatally infected. Perinatally infected young adults may have greater disease burden, less autonomy, and higher mortality risks as well. Encouraging retention and care among adolescents and young adults really is about facilitating trust. Utilizing motivational interviewing to acknowledge issues related to autonomy and other issues that may come up is really important and can improve adherence to medications. Being empathetic and really thoughtful in your interactions with adolescents and young adults is critical as well. Patient-centered communication that isn't just confined to HIV. There are things that may be more important and more pressing and may be impacting an individual's healthcare beyond just their HIV status. Understanding implicit biases that we all have as providers and as a healthcare center is really critical, and making sure that we're training everybody from your front desk staff all the way to the provider around implicit biases and how to overcome those. It's really a critical piece as well. Providing gender affirming care is important, and discussing self-management techniques to improve adherence and having a better sense of control is really critical for our adolescent populations. Peer-led interventions can be very powerful as well for young adults. And then adolescent-oriented resources can also help engagement in care. There are steps that we can all take to adapt our clinic to appeal to adolescents and young adults. Incorporating a youth advisory board can be critical. You really get the perspective of what's meaningful and what's important to adolescents. And by taking that information and building it into your workflows, perhaps even the appearance of the waiting area, the resources that are offered either in writing or in service to your patient population, all can be driven from a young adult perspective and can really help engage folks from the start. Including lay counselors or patient navigators in a multidisciplinary team can be very impactful, making sure staff are trained on adolescent development. And therefore, there can be realistic expectations about what to expect and how we can support our patients better. Offering age-appropriate educational materials, extracurricular activities, including community activities. Perhaps there are community centers or parties or other things that can bring folks together in a safe way so they can find fellowship and community. Providing comprehensive patient education also about antiretroviral therapy, sexual and reproductive health, and HIV as a chronic disease and not a death sentence, all are critical pieces towards empowering our patients to make sure that they feel that they have the information and knowledge to take control of their healthcare. The decor of the clinic can be really important, making sure it's approachable and has the feel of something that an adolescent would engage with or feels comfortable in. And considering a day or a time specifically meant to engage adolescent and young adults. Perhaps it's a drop-in hours in a broader clinic or flexible hours for individuals so that they can be more likely to engage in care. care. And then, of course, providing disclosure and antiretroviral adherence support is really important. A lot of adolescents struggle with how to disclose their HIV positive status to potential partners, friends. They have a long life ahead of them, and navigating living with HIV can be something that feels overwhelming. So making sure we're providing support around that is a critical piece. There are practical issues that may affect care engagement as well. And so discussing the implication of remaining on parents' insurance and potential lack of confidentiality is an important factor here. Many individuals, adolescents and young adults are covered on their parents' insurance, and there may be bills or ICD-10 codes that come through that may impede a patient's privacy, and they may not want to be in a position to have to discuss some of those things with their parents. It can be a real source of concern for patients and could reduce retention in care and ART adherence. And there are ways to potentially get around this. You may be able to send an EOB virtually or to an alternate address. There are things that can be done to try to protect an individual's privacy. Adolescents and young adults may lack knowledge of how to refill antiretroviral therapy at a pharmacy. The simple action of going in and getting one's medication may not be something that an adolescent has ever had to do before. And so providing support around some of those tasks, as well as education, can lead to more independence as well as better adherence. And then addressing concerns about stigma related to disclosure of HIV status is also something that many teens need support around. And then a real point of challenge for many adolescents that have been living with HIV is transitioning from an adolescent or pediatric setting to an adult setting. It can be very challenging, where there may have been intensive support provided in either a pediatric or adolescent setting, and going to an adult setting may feel overwhelming and difficult. And there may be new challenges and tasks that they will have to learn how to do. And so making sure that there is a very well-oiled support system in place so that transition is most successful is a critical piece. There are also strategies for re-engaging adolescents in HIV care who may have disengaged at some point along the way. Adolescents often prefer text or use of social media instead of a phone call or leaving a voicemail. Using more reminders could be important than you might expect for an adult, especially around text messages for adherence to medication. Offering flexible clinic hours, discussing logistical barriers. Somebody may not have their driver's license yet or may not have a job yet to have fare for public transportation. So support around that may be critical as well. Encouraging peer support, making sure that that individual doesn't feel alone is really important. And then, of course, financial incentives have been proven to work in the adult population as well as the adolescent population. And then using adolescent-friendly social media is a critical piece as well. So there are several methods for re-engagement in care that have been most successful in the clinics that I've worked in. I think for sure, utilizing social media, things like Facebook or Snapchat, as long as you have the adolescent's permission to do so, obviously not posting anything that would violate their privacy, but utilizing it as a way to say, hey, we're trying to reach you. Could you call us? That could be a way to make that happen without even identifying yourself as calling from a medical setting. Making sure that you have either drop-in hours or flexible hours has been a huge benefit to the patient populations that we've served in our adolescent programs. And then, of course, making sure that the setting is approachable, that we have friendly staff, that it's an adolescent-friendly environment. All of those things are really, really important and have led us to have successful re-engagement in care.